If you had to save a life in an emergency situation, could you do it?
I don't know.
I think a lot of us have had some maybe CPR training in the past. I was a lifeguard, but do you remember that training? Dr. Mobley back with us with an important refresher course. Okay, this I think is very important for everyone to get little reminders of now and then.
It's a real important issue, and one thing that always frustrates me as a physician is I think of just the friends and people that I know. Most of them can jump start a car, know how to use the jumper cables, but very few people know how to do CPR properly. So we want to just do some basic information that could help our viewers learn more.
Should we start with an adult?
Let's do it.
Okay, let's bend down and show us what we need to do.
First thing, if someone is found unconscious, first thing you want to do is you want to initiate the chain of survival, and that's not going to be you, the individual. It's going to be 911, the hospital, the ambulance, people that can really be the professionals. So before you get too worried about the victim, send someone to go call 911. First thing you do.
Okay.
Or if you have a cell phone, should you be on the cell phone yourself
we'll get to that.
and dealing with it?
Yeah, we'll get to that.
Oh,
First thing
okay.
you do is have someone call 911. Then assess the patient. Check and see if they're conscious. You know, hello, can you hear me? See if they can respond to you. If they can't, and you've already sent someone for 911, you want to deliver 2 rescue breaths. You do that by bringing the jaw up a little bit. That'll help open up the airway. Pinch the nose and deliver 1 breath.
Okay, Dr. Mobley, if they are on their stomach, should you turn them over?
As long as there's no suspicion of a head injury, it's safe to turn them over.
Okay.
And again, you couldn't resuscitate somebody on their stomach, so probably
Right.
weigh the odds and benefits. Probably better roll them over.
What if you've just gotten them out of the water? They maybe are potentially a drowning victim. Do you need to? How do you remove the water first? Do you need to make sure that their air passageway is clear of water?
Exactly. If it's a drowning victim, it's a little bit different scenario. You may want to first do an abdominal thrust to get expel some of the water out of the lungs, but then you would immediately go to the breaths and the compressions.
Okay, so we've done our 2 rescue breaths. What next?
We sent someone for 911. Now
Right.
we're going to start doing chest compressions.
Okay.
When you do chest compressions, you want to feel for a little bony prominence at the bottom of the chest plate there called the xiphoid process.
You have to feel where you are.
Exactly.
because-
Right.
Come up a couple inches above that
Okay.
and use 2 hands and straight arms. Real CPR, one thing that bothers me as a physician when I watch the TV shows, real CPR is pretty physical, and on TV they're just barely doing anything. You've actually got to really push and get that heart pumping. You're pressing the rib cage against the backbone and actually squishing the heart to get it to pump.
So you should not be worrying about breaking ribs or anything at this point.
We do break ribs sometimes in the hospital in real trauma
happens.
situations, and it's less important than getting the heart to pump.
Right.
So good, strong compressions using all of your strength
So your
on an adult.
top hand is
That's right.
on your bottom hand.
Exactly.
Okay. All right.
And use your full body weight. There you go. Boom. It's hard, and that's how a human being feels. It's
Wow.
it's physical.
How
That is
many
hard.
compressions?
You always want to compress the heart, whether it's an adult, an adolescent, or a child, 100 beats per minute. That's a lot.
Yeah.
Over 1 per second. So 100 beats per minute. The breaths on an adult, you want to deliver 15 breaths, 15 compressions, and then 2 breaths.
And then
15
2 breaths. Now, if you're alone, like Angie
Exactly.
said,
Okay,
then what do you
that's
do?
what I wanted to get to that. If you're alone, it's best to do the rescue breaths, do a minute of chest compressions with the breaths, and then take a break and call 911. People who have an irregular heartbeat might benefit from that first minute or 2 of CPR. So if you're alone, do the chest compressions, do the breaths, then take a quick break, call 911, and then continue doing that until you're exhausted.
Until they hopefully get there,
Until they hopefully
right?
get there.
Okay.
Absolutely.
What about a baby? Because I know so many young parents out there, even grandparents who are babysitting. What do you do if your child is in trouble? Because it's very different than an adult.
Should
Sure.
we hop up, Dr. Mobley?
We can do that.
Oh boy, I'm too old to get up.
So
Let me
with,
help you out. Okay, there you go.
So with the adult, we wanted to use 2 hands and all of our body weight to press forward. With an adolescent, that's someone who's older than 1 year and between 1 and 8 years, 1 hand. Now with a baby, they're so obviously fragile. It's the same area of the body, just above the little lower part of the chest plate, and all you just do is your fingers.
2 fingers, that's
2
it.
fingers. Best to have them against the firm surface again,
Okay.
because you are compressing the heart. 100 beats per minute, that's very fast. And then every 5 compressions to 1 breath.
And the breath.
Do you cover their nose and their mouth when you're breathing
With a
in?
baby,
With
absolutely,
your mouth?
because it's such a small area. You can get your whole mouth over the nose and the lips, and you do want to also always have that head extended.
Okay, so I
Okay.
have a 2-year-old, so it would be 1 hand.
Just 2 fingers.
2 fingers even on a 2-year-old.
I'm sorry, 2-year-old. Just 1 hand. Yes.
1 hand.
Yeah.
Okay.
1 hand on a 2-year-old.
1 breath, 5 compressions.
Exactly.
1 breath, 5 compressions. 2 breaths, 15.
5 compressions to 1 breath.
Right,
Yeah.
and then 15 to 2.
15 to 2.
We've
And
talked
you're
about
going 100 per minute. You're going quickly. It's going to be physical.
We've talked about CPR. Let's talk about choking. This happens. I can't believe how often. My brother was in a restaurant just a couple weeks ago, and his friend had to perform the Heimlich on
Sure.
him, and he said he was nervous that he wouldn't remember. Let's talk about that,
If
because
you've ever done it for somebody, it'll be the most heroic moment of your life. So
yes,
it's good to know how to do it
he was very
properly.
happy his friend
Sure,
remembered how to do
You're
it.
going to be the restaurant hero for sure. It's relatively simple to do, and just think of the anatomy. So you're
right.
choking, so you've got something stuck in your windpipe. It's basically at the vocal cord level about here. So we want to use the air that's in all of our lungs to expel that object. So I'll just demonstrate.
Okay.
Come behind somebody, kind of feel where their belly button is. Come about a fist height above that. Bring your fist just below the chest plate.
Okay.
And then you pull in. Obviously, you don't want to do it
Are
full
you-
strength, but you pull in
wow.
pretty darn hard.
Are you
Wow.
pulling in straight, or are you going up at the same time?
Straight and up. Again,
Straight
the
in and
mechanics
up.
is all of our lungs have a little bit of oxygen always in them. We're using that oxygen as a power to push that object out of your throat.
Right there.
So you want to pull back strongly, uply, and let that air in the lungs expel the object that's stuck at the level of the vocal cords.
Okay, let's talk about at what point you should do that. My husband and I always argue, if someone can tell you they're choking, if you can hear them getting air, at what point should you start the Heimlich?
That's a great question, Nisha. If someone can respond to you, don't do anything. If you can speak, you're not really choking that severely. It requires the movement of air across the vocal cords to have a voice, and so if you can say, I'm okay, you're probably not choking. If you are silent, if you're changing color, then you're seriously choking and need the Heimlich maneuver.
That's good to know if you're a victim.
And what if you're alone, though? What if I'm eating and I choke on something and I'm all by myself and I can't call for help and I'm struggling? Is there a way to perform the Heimlich on yourself?
Absolutely, and that's been pretty well studied. The best things to do there, you have two options. If you're choking alone at home, you want to try and find maybe a tall wooden stool or perhaps even a counter and actually kind of throw yourself against it. Try and let the tall edge of the stool do the Heimlich for you and get that again, the air in the lungs, pushing up, expelling that foreign body from the vocal cord area.
Well, this has been a lot of great information, but every parent, grandparent, even if you're single and you don't have kids, you should be certified in CPR. You could save your own life, save somebody else, be the hero. So contact your local Red Cross and get certified in both the Heimlich and in CPR.
Exactly.
Thank
This
you,
is just
Dr. Mobley.
great to know. Be here.
All right, more for your health when we come back.